Hey guys, I'm Dr. DeBeer. I'm a functional neurologist. I work here at Axon Integrative Health, and I'm here to chat with you about the Minimax by Hoolest. What we use it for, what we've been seeing with it, it's a fantastic PEMF device, PEMF, or pulsed electromagnetic frequencies, help to heal the cell, help to charge it up with energy, help to open up what's called calcium ion channels so that the communication and signaling into the cell and then signaling out of the cell or excreting toxins and waste products and things like that can all happen. All of those things can happen properly. So the PEMF Minimax, when we're turning these things on, we can choose whatever frequency we want. We can also choose the power intensity. And as you hear these clicking, you can have a patient laying on either a mat like we have here. We have patients lay on this and work on breath work. And you can really feel that through the core and through the chest, through the lats. What that's doing is really helping with blood flow regulation, and it's allowing for good activity through the gut and parasympathetic tone through the sacral plexus. We can also use a coil, and this coil can be used for spot treating various joints around the body. Wherever we see, or if we're having orthopedic or musculoskeletal issues, we can use this coil to really target these things. And we also use this quite a bit to really help pelvic floor stimulation. And we have patients sit on this and do breath work. And this is really awesome for incontinence for patients post-spinal cord injury or MS or Parkinson's, females, post-pregnancy, whatever we might be experiencing this incontinence for. We've been seeing really cool results with PEMF and using it this way. Other applications that we use with this are other specialty applications. So we use this mat here for patients and we have them either lie down or sit on a coil, but I'll lay down here and show you guys. We'll also usually combine this with Hoolest V-Relief, and we'll have the patients using this vagus nerve stimulation while they're feeling the PEMF come through their core and their lats and really allowing for all of that blood flow regulation to be happening. We use this setup quite a bit for patients with neurological issues, post-concussion, TBI, mild cognitive impairments, dysautonomia, POTS, fatigue, chronic pain, things like functional neurological disorder. We even use this for GI issues, SIBO, ulcerative colitis, IBS, dysbiosis, and other leaky gut issues. And usually these things are associated with neurological dysfunction. We really find that this PEMF device from Hoolest, this Minimax, is doing wonders for our patients and stimulating the nervous system and the cell itself so that they can experience their healing journey more efficiently, right? With less pain, with better outcomes, better efficiency. So if you're new to PEMF or you're a clinician or you're looking for a PEMF unit for your office, I would highly suggest Hoolest. I would really highly suggest these guys over at Hoolest that make this Minimax. We've been seeing really great results with a variety of our patients, applications with the patients that you see, and really develop a way to use this in your clinic. So with the coil, we use this as more of a spot treatment over various musculoskeletal areas, either directly over muscle bellies or peripheral nerves to really see contraction in these. You will also use it over joint spaces that might be painful or experiencing stiffness or rigidity or spasticity following neurological injuries or joint and musculoskeletal orthopedic injuries, tendonitis, stiffness, things like that. We've been seeing really, really great results even after the first session, sometimes third or fourth. Patients love this PEMF device. Patients love sitting here and really feeling like they're addressing this pain directly. And it's a change that they can feel in the moment. It's a change that they can feel upon going home, and that's lasting into their week. As continuation and through care and through your targeted treatment plans, this is a fantastic addition into functional movement patterns or chiropractic adjustments or dry needling or acupuncture or laser or any other modality that you might have in the clinic. This is a fantastic addition to that. If you don't have any of those, this is a great just sole use for musculoskeletal orthopedic issues as well as neurological neuropathies and things like that as well. So if you're looking for a PEMF device, I would highly suggest looking at this Minimax by Hoolest. They do great work over there. They really work with the doctors that use this on a day-to-day basis and develop technology that works in a clinical manner for the clinician and for the patients themselves. So check them out. It's a great PEMF device, and we see a lot of results with it.